Hmm. Hindi walang sounds, Carla.
Automatically muted. House rules and reminders. Participants are automatically muted upon entry to give everyone a pleasant learning experience. Use earphone or headset for better audio. We encourage you to hide your video and close some of your tabs or apps to save on bandwidth. This webinar is recorded. The attendees grants consent upon registration. In case you have any concerns while the webinar is ongoing, you may send a message to CPBRD admin in the chat box or in the event Viber group. Kindly accomplish the online survey form after the webinar. Instructions will then be given in claiming your e-certificate of participation. Copy of presentation materials and highlights of webinar proceedings will be posted on our website at cpbrd.congress.gov.ph. Q&A instructions. You may post your question in the chat box while the presentations are ongoing. If you want to ask your question in person during the open forum, please use the raise hand function so we can include your name in the queue. Please wait for the moderator for the prompt to unmute yourself. We will try to answer as many questions subject to the availability of time.
We are CPBRD.
Good afternoon, friends, colleagues, and our co-advocates on elderly rights. Welcome to the webinar on policy priorities for dignified aging in the Philippines, jointly brought to you by the Congressional Policy and Budget Research Department of the House of Representatives and the UP Population Institute. I'm Elizabeth Correg Estrada, your moderator for this event. We are expecting around 130 participants, and we now have 120 in the Zoom room. For those who have connected and watched on the HREP community FB page, also in the UP Population Institute FB page, as well as in YouTube, we may share the link in the chat section. Just a few reminders, please keep yourselves muted and on silent mode and also on video off, except for our panelists and speakers, please remain to do that. You may also follow the Zoom participant naming protocol. Abbreviate the name of your organization with your full name. So in my case, that would be CPBRD Elizabeth Correg Estrada. And just chat your questions, put them in the comments in the live streaming sites so that we can collate them and we'll see how many we can accommodate later in the open forum. Okay? Now we would like to first recognize the presence of some individuals. We have from the office, of course, our panelists from the offices of Representative Abante. We have Joan Sario. From the office of Congressman Ardanes, we have Attorney Charles de Belen. And of course, from the National Commission on Senior Citizens, we have Attorney Franklin Tijano. We also have our partners already now. And then we have from the Office of the Internal Audit Department, Director Maria Liza Pascual. And from the Finance Department, Deputy Secgen Dante Roberto Maling. We also have people from local government units, Salvacion Basiano, Sectoral Rep of NAPSI, for the Senior Citizen Sectoral Council, the Regional Acting Director, Jacqueline Robel of the Commission on Population and Development, and Dan Vincent Pedracio, City Population Officer of the LGU of San Juan. From the UP Manila Gerontology Nurses of the Philippines, we have Professor Linda Trentino Manahan. If we fail to promptly recognize you po, just message us every now and then. Okay po? A special hello as well to our friends from Cambodia who are currently in the House of Representatives. CPBRD is hosting a 12-member delegation team from Cambodia, and they're undertaking a fiscal analysis capacity training of Parliament Center of Asia. Just a brief context, in 2019, Congress enacted a law that created the National Commission of Senior Citizens, which basically transferred the mandate of TSWD on crafting policies and interventions for the elderly towards the new commission, dedicated specifically to advance their welfare. So we hope that through this webinar, we can have a better understanding of the current state of affairs of our vulnerable aged population and a discussion of the legislative priorities we must pursue to address this. So to officially open our webinar, may we request everyone to bow our heads for a short prayer and reflection. Loving Mother, thank you for your work and for gathering us today. Come bless this webinar and open our hearts and minds as we discuss the plight of our brothers and sisters. To grow in our lives and this enjoy to every person we meet. Now, ladies and gentlemen, please direct your attention to the screen and join us in the Philippine National Anthem.
Bayang magiliw, perlas ng silanganan, hanap ng puso, sa dibdib mo'y buhay. Lupang hinirang, buyan ka ng magiting, sa manlulupig, di ka pasisiil, sa dagat at bundok, sa simoy at sa langit mong bughaw, may dilag ang tula at awit sa paglayang minamahal. Ang kislap ng watawat mo'y tagumpay na nagniningning, ang bituin at araw niya kailan pa may di magdidilim. Lupa ng araw ng luwalhatit pagsimba, sa'yo.
Now that we're set, may I yield the floor to the Deputy Secretary General of the Congressional Policy and Budget Research Department, our leader and mentor, Dr. Romulo Miral Jr., for his message. Dr. Miral, you're muted po.
Okay, thank you. A pleasant afternoon to all, especially to my fellow senior citizen. For those who are not yet seniors, huwag kayong mag-alala, tatanda rin kayo. On behalf of the UP Population Institute, our partner institution for this event, I would like to welcome you all in today's webinar entitled Policy Priorities for Dignified Aging in the Philippines. Tatanda ka rin, tatanda rin kayo. Hearing these remarks from the elders sounds more of a warning than an inspiration. Truly, aging has its positive and negative aspects, and no less than our Constitution recognizes this. In particular, Article 15, Section 4 of the 1987 Constitution provides that the family has the duty to care for its elderly members, but the state may also do so through just programs of social security. Filial piety is a part of the Filipino identity. However, one of the results of the longitudinal study of aging and health in the Philippines point to the changing attitude towards filial piety, which is also observed in other Asian countries, whereby children may no longer deem it necessary to support older parents. On the other hand, parents may have lowered their expectation for support for fear of becoming a burden to their children. The study noted the lower proportion of parents, around 36%, who plan to rely on their children for financial support compared to 40% in 2007. This points to the need for empowering the elderly to take care of themselves as long as they can, and for the government to provide the necessary assistance. The senior citizen population in the Philippines, or those 60 years old and up, has doubled in the past 2 decades. Based on the 2020 Census of Population and Housing, senior citizens constitute 8.5% of the country's population, higher than 7.5% in 2015. The Commission on Population and Development, or POPCOM, reckons that the elderly segment will exceed 10 million by 2021, and by 2025, the share will increase to 14%. The government has pursued a number of initiatives in promoting the welfare of our elderly with the landmark legislation Senior Citizens Act of 1991, Republic Act 7432. This law has been amended several times to improve and increase the benefits of senior citizens with special attention to the less privileged. Notwithstanding the efforts of the government to uplift the condition of the elderly in terms of benefits, privileges, discounts, increased social pension, centenarian cash gift, and PhilHealth coverage, the lives of most Filipino seniors remain to be uncomfortable and for some, undignified due to poverty. We hope that through this webinar, jointly organized by the CPBRD and UPPI, we are able to impress the pressing need to come up with better policies and interventions that provide for the physical, mental, financial, and other basic needs of our nakakatanda. The presentation of Dr. Cruz will offer us
rate are really different, and we see that the fastest growing sector are the oldest population, 60 years and over, and the youngest age group, less than 15, have the lowest growth rate. So the 60 years and over have a small proportion of the population, but it's the fastest growing sector. Now, this is just showing how we compare with our neighboring countries as far as the process of aging is concerned. So the Philippines, as I've mentioned, as of 2021 is still there in the green bar, which means it's still categorized as a young population. But as I've mentioned, if we will transition to become an aging society in the next decade or so. Compared to Singapore, of course, that has already started to become in aging society as early as 2005. Japan, which is the oldest age structure in the whole world, is now considered hyper aging, with at least starting in 2010, with at least 30% of its population already in the older ages. So let me introduce to you some of the results of our studies done in the previous decades. And as mentioned earlier, our institute has been conducting research on older persons, and we actually produced the 3 national surveys on older persons, all of which were funded by foreign. These are all foreign funded. The very first one was done in 1996. We call it the Philippine Elderly Survey. And at that time, the structure of the Philippines was still very young, but this is really a pioneering study to really start looking at how the aging will play out in our country so that we can prepare for our aging society. The next one was done in 2007, which we call the Philippine Study on Aging. And the latest of which is a 2018 longitudinal study on aging and health in the Philippines, which is a panel design, different from the 1996 and 2007, because if it's panel, it means that you have to follow your respondents over time, and therefore it gives you a more powerful data than cross-sectional data because you are able to look at transitions which cross-sectional data cannot provide. So the LSAP objectives are twofold. First is to investigate the health status and well-being of the older Filipinos and their correlates. And when we get the second wave, which we hope to gather this year, we were just delayed because of the COVID-19 pandemic. We hope that to assess the determinants of health status and transitions in health status. So the sample is almost 6,000 respondents, 60 years and over, who are living in community dwellings. So we did not include older persons who are living in institutions. It's multi-actor in design, which means we did not only interview older persons, but also their caregivers and an adult child of the older person. So the study instrument is quite varied. No, we had at least 5 during baseline, but we're going to add one more in the follow-up survey. So we had a household questionnaire to find out the characteristic of the household context of the older person, with the main questionnaire for the older person, the questionnaire for the older person's caregiver, the older person's adult child, and we have an anthropometric questionnaire for older person where we did performance test. So we asked the older person to do some tests where we look at their gait speed, among others. So we also got their blood pressure, etc. Now, since 2018, were some of our respondents already passed on or who died, and therefore, when we go back to the field and follow them up, we're going to add another questionnaire for the mortality. So we have here the verbal autopsy and mortality questionnaire. So the study, as mentioned earlier, is funded by the Economic Research Institute for ASEAN and East Asia or area. And it's implemented by the Demographic Research and Development Foundation, which is the foundation of the UP Population Institute. So what are some of the major findings of LSAP? Well, the first one is that older Filipinos have poor health. And we have evidence to show this. For instance, during the COVID-19 pandemic, we were able to do analysis on some of these diagnosed illnesses which are considered risky for COVID-19. And this information will in fact very useful to inform, program intervention during the COVID-19. And our findings show that indeed they're very vulnerable, with 58% of them having at least one of the risky comorbidities for COVID-19. And as mentioned earlier, high blood pressure is the highest, with significant difference between the males, older males and females there. And the second, of course, is diabetes. And then this is followed closely by angina myocardial infarction, among others. Poor oral health is another finding. And I think this is something that we have taken for granted over time. But research in other countries show that this is really a significant indicator of health, because in old age, it's important for us to consider the chewing ability of older persons to ensure their nutrition and health. We look at the mean number of original teeth and found out that the total is only 9.41. So I hope we know the number of original teeth we're supposed to have. And we see here that there's a significant difference between the males and the females. So the females are more disadvantaged than their male counterparts. And if you look at I just want to mention that if you want to compare this with Japan, Japan has a motto that says they want to have 20 at 80, 20 original teeth at 80. So we see how far our oral health is relative to Japan. And this other graph shows us the percent with no teeth. If you look here, about half of those who are 80 years and over have no more teeth. Again, we see the gender difference here, with 35%, or about a third of older females having no more teeth, as compared to about 17% for their male counterparts. Obesity is another issue, which is as important as being underweight. So if you look at the data here, let's focus on all the older persons. 8.3% are obese and 21.9% are overweight. So together, about 30% of our older persons are either overweight or obese, and another 14% are underweight, both of which are in the extreme of the BMI and are both risk factors to other health illnesses. So about 56% are only within the normal BMI. And we see here that there are differences across socioeconomic groups. We use the wealth quintile here, where we divided our population into 5 groups. And we see here that it's really the richest, that are they have more problems with obesity. Right now, health is defined in terms of its transitioning to functional health. In the past, we used to define health in terms of diseases. So you are considered healthy if you don't have any reported diseases. But the definition has now transitioned towards functional health, which means to say that you might have certain illnesses or diseases, but if you have medicines and these are all controlled, then you can still function. So the measure of health now, as proposed by WHO, is the functional ability. And so here we ask questions on functional ability, and here we use the measure of the activities of daily living. We ask them if they have problems in performing any of these activities of daily living due to health problems. And our findings show that there's quite a significant 21% of older persons had at least one activities problems with their ADLs. They have difficulties. So in other Western countries, they use these ADL indicators as basis to suggest whether they should be moving to a home for the aged, because if you are living independently and you cannot use the toilet on your own, then it's time for you to move to a home for the aged. Of course, the situation is different in the Philippines, because most of our older persons are co-residing with their children and are taken care of by their children. There's significant health gaps as well, and our findings show, for instance, and these are the questions that the Department of Health has asked us to include in our survey because they wanted to look at how their current programs are doing. So our findings show that only 18% of diabetics who obtained free medication from the health centers all the time. So it's actually a policy or a program of government to provide free medication for diabetes, particularly to the indigent. But we see here that there's very low access, no? And the same thing with hypertension, 31% of hypertensives obtain free medication from health centers all the time. And only 80% are covered by health insurance, mostly under PhilHealth, but benefits remain inadequate. And I think we all know this. So this is quite surprising, of course, because we now have our universal health care, and which means to say that everybody, especially those who turn 60 years old or over or are older than 60, should be fully covered with PhilHealth. Many older persons have unmet healthcare needs due to financial reasons. So we asked them if they felt ill and thought about seeing a doctor, but did not in the past 12 months. And that is our measure for unmet need. And we see here that at least 29% among them exhibited a certain level of unmet need. No? And if you ask them, what is the main reason for unmet need, it's mostly due to financial reasons. So they are unable to seek medical attention because of lack of financial ability. This is an analysis that we tried to do during COVID-19 because at that time there were interagency committees that were looking at vaccine hesitancy and there were no data available. So we looked into the data of LSAP and using the vaccination for flu and pneumonia among older persons, because these are also some of the free services provided by the Department of Health particularly for the poor older persons. And what we found out is that there is really low level of knowledge and awareness of these programs, and there's indeed a significant number of hesitancy as well. So for instance, for the flu vaccine, only 10.7% are aware and are vaccinated. About 19% are aware but are not vaccinated, and 70.4% are not aware of this government program. Same with pneumococcal vaccine. The situation is better though, because about 22% are aware and are vaccinated, 19.3% are aware but are not vaccinated for some reason, and about 60% are not aware that such program of the Department of Health exists. For the first time as well, we were able to measure sarcopenia. And sarcopenia, according to the Asian Working Group for sarcopenia, is defined as an age-related loss of skeletal muscle mass, plus the loss of muscle strength and or the reduced physical performance without reference to comorbidity. So it's something that happens as you age, that you lose muscle mass. And prior to the LSAP study, there was no nationally representative study on sarcopenia among older persons. So we worked with our counterparts from St. Luke's, the geriatricians, and we studied the prevalence of sarcopenia and found out that the prevalence of sarcopenia and severe sarcopenia is about 6.8 and 6.4% respectively. And you see here that there's also a significant gender difference, with sarcopenia more likely to happen among the older males than the female counterparts. And the risk of sarcopenia increases with advancing age. Another major finding is economic insecurity of older persons. So we asked them their most important source of income. And here we see the significant difference between the older men and women, because the older men, 37% among them said that their main source of, most important source of income is their earnings from work, but this is not the case for their older female counterpart. Children transfers from children within the country is 26%, but if you add that from with the 10% who said that they also get from children abroad, that's about 36%, almost equivalent to that who said their earnings from work for their male counterparts. So pension here is 20%. They consider it 20% as 20% among both males and females as their most important, but actually, 40% receive pension, but only 20% consider it their most important source of income, indicating, of course, that the amount they receive from their pension is really not enough. Other indicators of economic insecurity, 46% said that they live in below poverty in based on their income, in the country's poverty threshold at the time of the survey in 2018. So the poverty level among older persons is much higher than the general population. 57% reported some or considerable difficulty in meeting household expenses. This is their self-assessed economic well-being, which is more or less comparable with the poverty level based on their reported incomes. And about half also said that they grew up in what they considered poor families. So it's like a lifetime of poverty for this 49% of older Filipinos. 47% are recipients of the 500 monthly social pension for indigent Filipino people, which we know is now currently being pushed to increased to 1,000 pesos every month. And whenever we present this to international audience, they will ask us how much is $500, 500 pesos, and we said it's $10, and now it's $8. So because of the exchange rate difference. 14% said that their household experienced hunger in the last 3 months. And another half said their household is a recipient of the conditional cash transfer, which is as we all know, is a poverty alleviation program for the poorest of the poor. And we also want to show here that LSAP research findings serve as inputs to programs promoting the well-being of older Filipinos. Our research is being used by the Department of Health, as I said, to assess their programs, and as well as crafting new health program intervention for older persons. And in particular, our study findings were used as inputs for the health and wellness program for senior citizens, manual of operation for local implementers. They also crafted a geriatric training manual, which used the results of our study. Commission on Population and Development has also made use of our study. LSAP research findings serve as inputs in the Philippine Population Development Program Plan of Action for the period 2023 to 2028. And they also use our research because we did some collaborative research with them, analyzing the LSAP data, and that the studies produced are used to support PAPCOM's policy advocacy on older persons and their participation in international dialogues on older persons. Of course, the Department of Social Welfare and Development have been using our results as well, particularly as an input in the Interagency Technical Working Group on active and healthy aging and development. Same with the National Commission on Senior Citizens. We have presented our results in the radio program of the chairperson at least 3 times already. We also are inputting with the Commission on Human Rights. LSAP findings were presented in the various Commission on Human Rights Capacity Development Program on Human Rights of Older Persons. And the results of our last 2 rounds of study, the 2007 PSOA and the LSAP findings, are used as inputs in the UN Open Working Group on Aging, which is being organized by the Commission on Human Rights. Of course, there are NGOs that are very active in elderly care, particularly COSE, and they have been using our results a lot. The challenge, therefore, is to maximize the use of LSAP research findings as basis for more science-based laws, focusing on the health and well-being of older Filipinos. And that's why we're very glad that we have this webinar so that we can share our findings to policymakers. So what are some of the recommendations emanating from our study? So I think it's clear that there is going to be an increase and continued increase in the number of older Filipinos in the near future. And therefore, our government must prepare to correspond and respond to the needs of this significant and increasing number of older persons. So what do we need? I think we need to create more laws that will improve the older person's economic status. We see that there's a significant level of poverty among them. And therefore, we need to look at the retirement benefits. Their social pension should be reviewed because 500 pesos a month is too low to make it more responsive to the current living conditions. We reviewed some of the pending bills to address the poor economic conditions of older persons, and we're very happy to see that there are already a lot of pending bills to really address their economic status, including, among others, an act increasing the social pension of indigent senior citizens, expanding the coverage of senior citizen discount, free dialysis, among others. We also need to promote a health, active aging, including mental health and overall well-being of older persons. Because as we see the major findings, when you grow old, our studies show that the problems that besetting older persons are really their health and income. So there's a need to promote healthy and active aging to lessen the burden of curative care. And promoting healthy and active aging doesn't mean interventions when you are already 60 years old or within that vicinity of your age, but really looking at the whole life course. And that is why the approach to healthy and active aging should look from womb to tomb and look at the health starting from childhood, infancy until childbearing ages, and that's where you ensure that they will enter their old ages in good health. No? And of course, there's a need to encourage healthy eating habits. We look at the nutrition surveys, and they tell us that obesity is also prevalent among our younger sector of the population. So we have to take a look at all of this, including good oral and health practices, healthy lifestyle through proper diet, exercise, stress management at all stages of life. And of course, there's some already policies existing to promote well-being, including the expanded Senior Citizens Act, Universal Health Care Act. But of course, we have to look at the way these existing policies and programs are being implemented. We have also noted some of the bills that are already there at the Senate, the Philippine Geriatric Medical Center Act of Senior Citizens Hospital Act, among others, about kayang gamot, because really there's a lot of unmet need there in health, as we see, because they cannot access these medicines, and promotion of elder rights, including homes for the older persons, particularly those who are abandoned. Of course, elder abuse is also there, and I understand there are already sectors of the government and non-government organizations that are addressing this. So we need more laws that will support. Of course, as a researcher, I would like to end by pushing the agenda for laws that will support aging research to prepare for healthy and active aging. I think we need scientific basis for crafting our policies. And as I mentioned earlier in my presentation, all of the national surveys on older persons in the country have been funded by international funding agencies. So it's about time that government should focus and give more funding to research in general, and of course, aging research in particular, so that we can have better preparations for the future for a healthy and active aging in the Philippines. So we have to focus more, for instance, about to look at more accurate and timely data. We have As demographers, we see the limitations of data that are basis for our research, including mortality data, for instance. And we need more research on how to improve the health and well-being of older Filipinos in general. So we look forward to a greater collaboration with multiple sectors of society to ensure the health and well-being of the older persons. So thank you very much for your attention. And this is a report that is based on the baseline data of our study. It's you can download it if you're interested. Although we already distributed hard copies to various offices, but if you're interested, you can perhaps send us a message so that we can send you hard copies. And like to acknowledge, of course, our funding agency area for funding our project. And of course, we would like to acknowledge the Congressional Policy and Budget Research Department of the House of Representatives for inviting UPPI to share our research this afternoon. Thank you very much, and we look forward to a more active discussion later. Thank you.
Maraming salamat po, Dr. Grace. Thank you for that very insightful presentation. Wag po tayong mahihiyang magtanong. Please fill in your questions in the comments, in the live feed sites, also here in Zoom. Start posting your questions na po so we can collate them. We already have around 145 attendees, so please keep your questions coming. We are honored to have with us Director Maria Aurora Mora of the Budget Service. We now move to the next presenter to further add color to the discussion. Let's listen to Mr. Sunny Boy Afable as he presents possible proposals for intervention based on his findings on late life depression among Filipino seniors. Sir Sunny, you have 20 minutes po. Sir Sunny, you're muted po ba? Please unmute yourself.
Yeah. Ayan. Can you hear me now?
Loud and clear po. Thank you.
Ayan. So, magandang hapon po. I am honored to be sharing this space with experts and policymakers who care about our aging population. Kanina, Dr. Grace Cruz provided an overview of the older persons in the Philippines, and we have seen that our older persons are economically challenged and suffering from poor health. This time, I will be presenting my study, which draws attention to an area that is largely understudied, namely the mental health of our older persons. Let me begin by emphasizing that mental health is an integral aspect of dignified aging. Mental health has a large role to play in one's daily functioning, interpersonal relationships, and even contribution to society. A growing older population, however, poses a challenge to the country's healthcare system in general, and mental health care in particular, which is already strained as it is. At the same time, existing gaps in our healthcare system are a major issue that poses a challenge to older persons' well-being. And to give you an overview of these gaps, the Philippines has the third highest prevalence of mental disorders in the Western Pacific region, but only 5% of our healthcare expenditure goes to mental health. At a ratio of less than 1 per 100,000 Filipinos, we have less than 1,000 psychiatrists all over the country. It's one of the lowest in Asia Pacific. The Philippine Mental Health Act was signed in 2015. Now, this landmark law provides a rights-based approach to mental health, but we have really yet to see its proper implementation. The particular interest of my study is depression, which, alongside with anxiety, is the most common mental health condition around the world. This discussion is particularly relevant given the psychological toll of the pandemic on older persons. As one commentator puts it, there has been a pandemic not only of the virus, but also of depression and anxiety around the world. And there are three burning questions that my study wants to help address. First, is depression a consequence of aging? Failing to address this can lead to misconceptions about aging. Second, why are the rates of depressive disorders higher among older women? In general, the prevalence of depression in women is about twice that of men. And as to why this is the case remains a fertile subject of research. Third, how does the exchange of supporting children affect older person's psychological health? This question is especially relevant in Asian societies like the Philippines, where strong traditions of filial piety or pagtatanaw ng utang na loob are challenged by changing family norms, dynamics, even migration, and changing attitudes among the younger generations. And so, given these contexts, my study primarily aimed to explore the demographic correlates of depressive symptoms in older Filipinos, with emphasis on the possible gender differences in the presentation and risk factors of late life depression. And I lay down three specific objectives. The necessary first step is to understand how depression manifests in older Filipino men and women. Compared to younger age groups, depression can present differently in older persons. Second, I examined the association of demographic variables with the depressive symptoms, controlling for health, psychofactors. And third, all of these analyses are stratified by gender. So for this study, I used the baseline data of the 2018 longitudinal study of aging and health in the Philippines. Again, it's a study conducted by the Demographic Research and Development Foundation with funding support from the Economic Institute for ASEAN and East Asia. In the LSUB, the 11-item CSD scale was used to measure depression. In various populations, the CSD scale has been found to be a good tool for assessing depressive symptoms in the general population. A total of 5,209 community-dwelling individuals were interviewed regarding how often they experienced the symptom in the last 3 months. So here are the major findings of my study. First, I found that depression is predominantly an emotional and physical sensation for both older men and women. In older men, however, it is most prominently physical, as indicated by symptoms like having poor appetite, feeling that everything is an effort, having restless sleep, and lacking motivation. In women, on the other hand, depression is most prominently affective, as indicated by feelings of being depressed, lonely, and sad. It is also worth noting that depression manifests in interpersonal relationships, such as the perception that people are unfriendly and dislike you. Finally, the positive affect is the least contributing factor. Now, this suggests that having positive feelings does not necessarily mean lacking depressive symptoms. The next set of results show the factors that are associated with late life depressive symptoms. First, in terms of gender, women had generally more severe depressive symptoms. In terms of age group, in men, there seems to be an increasing trend and a slightly curvilinear pattern, but there were actually no significant age differences in the depression score by age in men, except for that sudden elevation in depression score at the oldest age group, 85 to 89. In women, on the other hand, the curvilinear age pattern is more evident. It's concave down with trough at age group 75 to 79. So after, from 75 to 79, the severity of depressive symptoms increases. But when we control for the presence of other factors, most variables in which we had found significant variation were no longer significant in men, except for the wealth index. But first, let's look into age. The quadratic age term proved significant only in women, and the graph right there plots the relationship. The severity of depression actually declines until about age 85, at which it begins to increase. We also find that for women, being unmarried, more so living alone, is associated with more severe symptoms. Those who are working, on the other hand, with lower levels of depressive symptoms. For both men and women, higher household wealth is associated with less severe symptoms. This means that those who come from poorer households are more susceptible to having depressive symptoms. In terms of the health-related variables, both trouble with pain and the heart illness diagnosis were positively associated with depression in men and women. Now, we are concerned about pain because in older persons, it indicates an underlying condition. Unfortunately, many of them are hesitant or don't have the means to visit a doctor. That's why they just complain about pain. We also find that high blood pressure was negatively associated with depression. It's quite counterintuitive, but this is in line with recent studies. Other variables are not significant. Now let's turn to the psychosocial variables. The gender difference is more pronounced in intergenerational exchange, or the exchange of support between the older person and their adult children, which showed no consistent pattern but reveal as much about older person's roles in relation to their family, and I will expound on this point later. For both genders, being a member of a secular organization was also a negative correlate of depression. Majority of the organizations cited by the respondents include the local offices of Senior Citizen Affairs, or OSCA, which are not really organizations but government offices, if I'm not mistaken. But these result indicates that OSCA can provide a sense of organization to older persons. So at this point, let me wrap up the results and try to make sense of them. So is depression a normal consequence of aging? Well, the study found that depression is not a normal consequence of aging. In fact, the observed increase in depressive symptoms is not an effect of age in itself, but a function of several factors that interact with or come about in the aging process, including disability, poor health, and one's resources and social networks. In women in particular, depressive symptoms decline with age, but rises in the oldest old, suggesting a terminal life crisis that comes with the increasing realization of their mortality, as well as the possible effects of the unique experiences of those who lived through the Great Depression and the Second World War. But what could explain the higher prevalence of depressive disorders among older women? This study found that depression in women relates more to the depressed affect, meaning that they can be more emotionally aware and are more likely to ruminate, as several studies have shown. This could help explain why depressive disorders are higher among women. Meanwhile, many of the factors associated with late life depression, including widowhood, living alone, and lack of connection with children, could weigh more on women. So perhaps these findings could help us shed light on why the rates of depressive disorders are higher among women. Now, what explains the link between gender, intergenerational exchanges, and depression? One explanation that the literature offers is the concept of role identity. It essentially argues that the triggers of depression or the emotional impact of events relates to their importance in men and women's role identities or yung kanilang pagkakakilanlan. No? For instance, in this study, we find that receiving material and giving emotional support are associated with lower depression scores in women, while living alone is associated with more severe depressive symptoms. Now, these things relate to the family, particularly women's connection with their children, which has been argued to be more salient for women than for men. Meanwhile, in men, depression was negatively associated with giving material support, but receiving it is correlated with higher depression scores. And this is something that reflects their masculine ideals. Our society socialized men to be the family provider. And so when they receive material support, they feel like it violates this role identity of being the family provider. But we also have to take note that providing financial support is associated with higher depression scores in men. This is somewhat inconsistent with the role salience theory, but here the concept of social exchange could be relevant. For instance, it's possible that giving financial assistance to children represents a burden to older men and an imbalance in social exchanges with their children. This makes sense when we consider the fact that due to poverty, many older men are still working despite their advanced ages, as Dr. Cruz's presentation showed earlier. So, having said all of these, where can policy possibly intervene? First, we need to include mental health services in care packages for older persons. This entails the early detection of mental health problems, scaled up efforts for treating these problems, and actions for erasing the stigma around people with mental illness. When older persons are particularly less inclined to talk about depression than the younger generation. Second, the association between depression and pain highlights the need to identify and manage both conditions. These two conditions are not normal consequences of aging. Both pain and depression management should be part of the free medical packages being provided to the older persons. We also need to consider the impacts of the COVID-19 pandemic and the lockdown on older persons' psychological well-being. Policymakers should especially consider older persons who are living alone, older men and women who may have been separated from their children and loved ones, and those who were widowed by the virus. We need to expand, for instance, psychological counseling, telehealth services, and community-based interventions for older persons. We also need to support, strengthen, and expand the pension program and similar social welfare interventions. Having noted earlier the socioeconomic disparity in the severity of depressive symptoms, the LSUP report underscores that older persons have extremely low level of financial resources. Right now, we do have the 500 peso monthly social pension program. It's clearly a good step in the right direction, but maybe we can do better than that. The senior citizen ID, on the other hand, is only useful to those who have spending power in the first place. Findings also emphasize the need for gender-sensitive and gender-responsive, if I may stress, interventions in screening and addressing late-life depression. Older men are found to be generally reluctant to depression treatment, or even to be associated with the term depressed, due in part to their masculine ideals or image. Among women, depression may be triggered or compounded by family events like the phenomenon of empty nest, where adult children leave their parents, as well as the death of their spouses. It's important that we take a gender lens in our interventions. We can also strengthen community-based efforts, which could especially benefit older men, as some studies indicate. We can, for instance, tap into the volunteer spirit of older persons in our child care programs, which is being advocated in other countries already. In a separate study, found that participation in organizations does not necessarily decline with age. It's only that older persons are hindered by their poor health and socioeconomic conditions. Finally, we must pursue evidence-based policies for older persons and for the rest of our population for that matter. And with that said, I encourage everyone, especially the social scientists and policymakers in the audience, to check out the rich sources of data that are painstakingly gathered and analyzed by the UP Population Institute and its partners, including the DRDF and area. Special acknowledgement to the Economic Research Institute for ASEAN and East Asia in particular for funding the LSUP, the second wave of which is already underway. Before I end, let me say that I think we need more engagements like this between the academe, the policy and program sector, and the basic sector, of course, if we want to solve the most pressing issues of our time. Thank you very much for listening.
Yeah, thank you po, Mr. Afable. Before we continue, may we welcome again the Cambodian delegation who are undertaking a fact training right now under the Parliamentary Center of Asia, led by Dr. Sawthorn Kem. So they're currently tuning in. Physically, we set up a mini classroom style viewing area here in CPBRD office. So welcome po to the Cambodian delegation. Like me, I'm sure you're still digesting so much information on the health, economic status, overall well-being of the elderly. Ako, nalungkot ako, 49% of those who were surveyed, at least the data gathered is that 49% have lived a life of poverty. So kahit sabihin mo that age is not, you don't necessarily relate age with depression if you've lived almost all your life in poverty. Parang nakakalungkot nga talaga siya. Anyway, so aside from this eye-opening insights that we got, it's exciting to listen to this types of researches that enable us to craft evidence-based legislation and policies, which leads us to the next part of our webinar, the reactions of our three distinguished panelists. But let me introduce them first. Let's start with our panelist who's present with us today. Can we have the video of Attorney Franklin Quijano show? There, okay, the bio-sketch. Attorney Franklin Quijano is the chairperson and CEO of the newly created National Commission of Senior Citizens, or the NCSC. A human rights lawyer, Chairperson Quijano was a two-term mayor of Iligan City before consultant to the National Electrification Administration. He has established himself as a peace advocate and mediator, having been engaged in this sector for at least 2 decades. In fact, he was a consultant of OPAP. Before leading NCSC, he was the CEO or administrator of Vividec Industrial Authority, a GOCC, which manages a 3,000-hectare industrial estate in Misamis area. Welcome po, Chairperson Quijano. Our second panelist, Representative Rodolfo Ordanes or Kong Umpong, can't be with us today, but he sent us a pre-recorded video of his feedback, as well as an official representative through Attorney Charles Fredrickson de Belen. Welcome po, Attorney de Belen. Rep. Ordanes is at present presiding over the meeting of the Special Committee on Senior Citizens, which he chairs. So, Senior Citizens Day po talaga ngayon. Sabay po na sabay eh. Kong Ampong is the leading advocate in the HREP for Senior Citizens Welfare, being the Senior Citizens Party List representative. He is the principal author of RA 11916, which basically increased the monthly SOC pen from 500 to 1,000 pesos. He is also the principal author to numerous bills like the establishment of the National Geriatric Center, establishment of the 70 to 80 to 90 years olds, and among others. Kong Ordanes has a long history in the public sector, being a civil servant for 32 years, having served as Quezon City's city assessor until his retirement. And finally, a representative of 6th Legislative District of Manila, Representative Bienvenido Abante Jr. chairs the Committee on Human Rights, serves as Vice Chair of the Committee on Good Government and Public Accountability, and Vice Chair of the Committee on Appropriations. Among the bills for senior citizens he principally authored are for the establishment of the National Geriatric Center and the increase of SOCPEN. Rep. Abante is the founder of the Metropolitan Bible Baptist Church and Ministries, and also the president of the Bible Believers League for Morality and Democracy. Unfortunately po, an urgent and unexpected matter required Kong Abante to fly out of the country. Nevertheless, Kong Abante provided us with his written feedback to be shared with us by no other than his Chief of Staff, Ms. Jacqueline Joan Saria. Welcome po, Ma'am Joan. So now we move to the feedback, to the reaction portion of our webinar. We first listen to Attorney Quijano as he shares his insights on the findings shared by the
presentation of tatanda ka rin. Di ba, Dr. Miral? Tatanda rin kayo. But then again, I realized that as I was listening to Dr. Grace and Dr. Sani, the burden of carrying the responsibilities for the senior citizens are getting heavier. Just like to inform you that Republic Act 11350 is a newly passed law on July 25, 2019. And somehow we have to make certain distinctions, more especially because there was a decision by the Supreme Court which says that the funds of the national government must now be shared more to the local government. It is called the Mandanas ruling. This law was passed on April 9, 2019. Even as we say that the subsequent, this decision was passed on April 9, 2019, although we say that the decision, the law, Republic Act 11350 came in later, we will have to consider the Mandanas ruling on the light of empowering and giving resources to the local governments. Nonetheless, what we are really looking at is this law, the National Commission of Senior Citizens Act, really tends to empower this sector, and we hope that the event today will help more on how we will be able to unite and coalesce to be able to bring about more significant support to the senior citizen. Can we proceed, Charles?
Thank you, Chairman Quijano. I think before I continue, I was informed that we're going to flash the message of Congressman Ordanes?
I am sorry, I didn't know that, Attorney Charles.
Okay.
No, Sir Charles. After Attorney Cajano, we will be flashing the
Okay,
message
so
of Congressman Ordanes.
I'll start my reaction already.
No. We'll finish
Is
with
that correct?
Attorney Quijano and
Okay.
then I'll call you later.
Okay.
Right after him. Right after
Okay.
him. Sorry pa.
Chairman, I'll defer the floor back to you. I think you'll be the first one before our reaction. Thank you, Chairman.
Sorry pa for the confusion. Thank you po.
Thank you. So let me continue my presentation and reaction. I think Dr. Grace and all the rest are familiar with this, but let me just say that the Commission is aware that it has to perform the task of being integrative by taking all the laws that have been passed, including the Accessibility Law 7432, 9257, and 9994, also the Local Government Code, and that senior citizens must have a good place to interact, that is the Senior Citizen Center, and that we are all conscious that our social reform agenda must be focused on alleviating the constant marginalization of our people. Of course, we have the universal health care, which we will explain later to be very useful for the senior citizens, and the centenarian law and all the other UN and international agreements. Next chart, please. We defined our mission as we were created, and realizing that we have to integrate all the sentiments, the learnings, and making it lifelong for the senior citizens. We have to have an integrative agency that will implement all the laws passed, as well as the future policies and laws. Next, Charles. One of the realization we have is that we must not just be focusing on what the senior citizens must receive, but also look at the potentials of the senior citizens. And so even as I'm not sure if Dr. Miral is already senior, but yes, he has lots of things to share. And we are actually trying to formulate a program for senior citizens to be sharing more to our country. Of course, knowing that for years we have been working with all our efforts to help this country, we also deserve to be receiving the much needed attention for the senior citizens. Next, Charles. So we would like to restore the senior citizen to the dignity that was given them in the previous years, or the previous lives that they have, when the seniors were supposed to be centers of the activity of a tribe and a clan or a small society. However, we know that we need to do more to restore the status of the senior citizen. Next, Charles. And so even as Dr. Grace has defined aging, we would like to add that the aging population is not just a phenomenon, but we have to address this from the point of view of the medical side, and that is aging starts when we were born, and that the molecular and cellular challenges comes through aging, and that, well, they say aging is part of life, and therefore aging is living. Next, Charles. So all of us are all in one, perhaps, in saying that we are for longer life, but perhaps it would be good for us to have longer lives, but longer and healthier lives. And the conditions existing in our society right now brings about certain challenges where our lives may be long, but there may be certain difficulties in terms of health challenges. And so I hope that all the sectors in our society, all the agencies will unite in order to encourage a longer and healthier lifespan. Next, Charles. So the current challenge, therefore, needs to be addressed, and that is immunity being the name of the game. As we are born, there are so much in immunity that we have as part of the design of our bodies, and we get our booster from the mother's milk. But that as we grow old, the immunity is challenged. And so I think we also need to educate our people in terms of when will we get our vaccination. When I was a kid, I got my vaccination at age 6 or 7. But then maybe the education program has not been very conscious of this, and therefore, as we grow old, the issue of Hep B and all, and flu and anti-pneumonia may not have been consistently being propagated. And so I think this is one area which we can work on together. Next, Charles. So as pointed out by Dr. Grace, population of the country is going to be aging from a young population. And although there may be certain differences in figures, I'd like to side more with Dr. Miral when he said that in 2021, the population is 10 million. That is what we would like to interpret in 2022. We would like to believe that we're about 12 million already. And therefore, we are already on the stage of aging. However, we would like to say that we have to create some programs, not necessarily by government, but by all of us using the intergenerational approaches, by which we will be conscious that there will be more and more people who are going to be old by 2040, and that if the family is not conscious of this, then a lot of people will be left out. I'd like to call your attention that there are only 4 government-managed residential care facilities in the country. One in Quezon City, the other one in Tanay Rizal, the third one in Zamboanga City, and the fourth one in Davao del Norte. If we will not increase the number of residential care facilities, we will have a problem of how we will address the aging population. And so we hope that all the sectors will be able to create programs uniting the families together, perhaps a better dialogal Christmas together for all of us. Next, Charles. Well, just to mention, in Japan, for every 10, there are 4 senior citizens. In the Philippines right now, for every 10, there is 1, but it can increase to 2 in no time at all. So our direction is perhaps create a whole of government and a whole of nation approach by which we will be age-friendly. There are some local governments who are responding favorably, not only in terms of social pension, not only in healthcare, but in terms of dialogue. I hope that in many forms that we can, we will be able to encourage age-friendly situation. Of course, conscious of our limitation, just like what Dr. Afable was saying, that there are only 1,000 psychiatrists here in our country. I realize there are only 200 geriatricians in the Philippines, so 112 million by 200 is really something big. And so I hope that even the number of health professionals will have to be encouraged to increase. Conscious about that, I would like to commend the efforts of Congressman Ompong Ordanes for creating a lot of proposals for the senior citizen. Is it possible for a multiple retirement rather than just lifting the retirement? Can we allow our workers to retire, say, at age 45 or 50 and then work again and retire again at the age 65 and work again and retire at a later age of their choice? I have met one Phil Am, who was working as a safety officer at age 80. I guess the issue of mental health and physical health may even be more addressed if people are allowed to work. Our farming and fishing sector are still very active. May marami pa pong senior citizen na nagtatrabaho sa dagat at sa ating farms, and I realized that perhaps more exercise would mean a healthier life. So next, Charles, please. So a multi-sectoral approach, developing a roadmap for the seniors will also mean a multi-sectoral approach, developing a roadmap for all. We cannot just say, let's take a look at the senior citizens, beginning from infancy, the consciousness for a healthy lifestyle, the consciousness for a productive lifestyle is really there. So I'd like to thank everyone for the time given. Can we proceed to the next item, Charles? The 4 programs of the National Commission of Senior Citizens are all there. Actually, we're just summing it up to say Senior Citizens Action for Development and Nation Building, because we believe that tatanda din kayo pero marami pa man ding magagawa kung tatanda tayo. We could help develop our country. We need to be productive, but for us to be productive, we need to be healthy. And of course, our being senior citizen would also mean that let us be protecting the rights of the seniors. Let's protect each other and see to it that the welfare of the senior citizens be observed. We are now on the transition towards asking the SWD to transfer the functions to us, especially on the issue of the social pension, which right now is being debated in Congress. Hindi pa po kompleto yung ibabayad for the additional 500. So there is a risk that hindi siya magiging 1,000 sa lahat. From what the discussions I have with some of the legislators, baka ilan lang ang makakatanggap ng 1,000, hindi lahat ng mga indigent. I hope that we can lobby some more so that magiging 1,000 talaga yung mga indigent seniors. And then of course there is a lobby, and I'm conscious that Kong Ompong and the other congressmen are moving towards hindi lang centenarian, baka octogenarian and nonagenarian ang makakatanggap ng benefits. Although our coffers are very tremendously challenged, kaya mahirap yata. But again, I think some local governments are starting to do that. And then, of course, our care facilities will have to be improved. And our senior citizens are vulnerable to risks. The fire the other day has taken the life of a senior citizen, the disasters that we are facing. All these programs which we are sharing to you actually will redound to the benefit of the seniors if all of us unite together. And finally, what we actually need, which the UP Population Institute and our scholars may be able to help, is really a very reliable database. In our when we went around the country to get the database, we realized that the database that we were getting is not complete. We only got names and addresses and income condition. We were hoping that we'd be able to get more, like what about the skills of the senior citizens? What skills can they share to our country and our people? What about the health condition? Finally, I'd like to point out to you that we have a MOA last October 7 with PhilHealth. And the MOA contains an agreement that all senior citizens must have an annual medical dental, oral, and ear examination. I hope that we can all help also inform the public that when the senior citizens are aware of their health condition, the objectives of the primary health care, preventive health care will also be given attention to. So I'd like to shorten this by saying thank you very much. God bless.
Thank you very much po, Attorney Quijano. Maraming salamat for the insights and for partly answering some of the questions posted in the chat. You may also want to directly answer po. There was a question related to how supportive is the government in extending yung work for seniors, yung opportunity for seniors to work. We now move to the next reactor. May we share with you the pre-recorded video of Kong Ordanes? Apologies po for the technical difficulty. Let's just wait. So we request we requested Kong Ordanes to give us at least 5 minutes feedback on the findings of Dr. Cruz and Mr. Afable, and thankfully he obliged. Attorney De Belen, would it can we unmute Attorney De Belen? Maybe his connection is better and he can share the video. Can you try po, Attorney De Belen?
Unfortunately, I don't think I can share because I'm
Can
also
you give
connected.
him the host? Hindi rin kaya.
Yeah, I don't think my connection can handle the.
Okay, so we'll try again. Or is it okay, Attorney De Belen, if you can move to the feedback of Kong Abante first while we're figuring out the technical issues? Plinay po namin kanina, okay naman. Now we'll try for the last time.
Like this, which, while critical. Good afternoon to my colleagues in Congress with us today. Our senior citizens whom I know are intently watching this webinar. Our Congressional Policy and Budget Research Department, under the leadership of Dr. Romulo Miral, who made this webinar possible, and our speakers, Dr. Grace Cruz and Mr. Sani Apable, whose invaluable research into our senior citizens will surely guide our future legislations for our senior citizens for many years to come. I want to thank both of you for putting effort into researching topics like this, which, while critical, are severely under-researched, from the prevalence of depression amongst us to our need to shift our programs and policies from being curative into an active and healthy aging framework. I cannot emphasize enough how important this is considering that our country will soon transition into an aging society. As stated by our esteemed speakers, our senior citizens live in dire circumstances, and the pandemic only aggravated their socioeconomic vulnerabilities. I echo their sentiments on how 30% of us have unmet medical needs due to a lack of financial resources. Only 31% of hypertensives and 18% of diabetics obtain the pre-medication they need from health centers. Furthermore, while 80% of us are covered by health insurance, nearly all of them are under PhilHealth, whose coverage is simply not enough. In fact, 75% of our seniors need to supplement PhilHealth coverage with their own or their children's funds just to make ends meet. To further aggravate the situation, Dr. Cruz found that 86% of our seniors rely on their children for their economic needs, while the 2018 longitudinal study of aging and health in the Philippines using the CES scale of Mr. Rapable showed that senior citizens have depressive symptomatology. I cannot emphasize enough why these findings are important, because this only shows that whatever we are doing today is simply not enough. We need to do more in strengthening our programs to protect our senior citizens and promote a framework of active and healthy aging. This is why I want to take this opportunity to ask for everyone's support in helping the bills I filed become law, from providing our senior citizens economic relief through the universal pension, their income tax exemption, abolishing compulsory retirement, promoting their employment, or expanding their rights and privileges under the law, to increasing their health security by making their maintenance, medicines, vaccines, annual health checkups, and dialysis free. And finally, the creation of the country's first specialized geriatric hospital. Through these measures, I believe that we can take the first step in addressing the concerns raised by our speakers and move towards an active and healthy aging framework. So, I hope that we can all work together in ushering a better life for our more than 12 million senior citizens today. Thank you.
Attorney De Belen, would you like to add to that? You have a few more minutes, Paul.
Hello, good afternoon. First, I want to echo the statement of Congressman Ordanes. When we started with the policy making in our office, what Congressman Ordanes found was that the problems of senior citizens are usually invisibilized in our society, because we have this perception that if you're a senior citizen, or most of our senior citizens are already capable enough, they have families that will take care of them. Their medical needs are always supplemented because we already have existing privileges that we extend to them. But what we found out later on during our tenure is that in most cases, these are actually non-existent. While the dream of a Filipino retirement exists for some, but in majority of cases, our senior citizens do not get to enjoy their retirement, and that's why we want to extend our deepest gratitude to Dr. Grace and Dr. Son, because during our journey in policymaking or legislating for senior citizens, it was very difficult for us to actually find or look for research, especially recent ones, that we can base our policies into. Most of the research that we usually use are come from foreign sources such as the UN, the WHO, and the ADB. And we felt that it's because senior citizens and their plight, because of its invisible nature in our society, it's usually a less traveled path. So extensive research on these matters are extremely welcome, and we're definitely going to use it in future legislative efforts. To begin, what we found out, and I think what was crucial facts that were presented was that, for example, right, out of 12, well, we have 12.6 million senior citizens right now. What we need to know is that only 4% of them, out of the 12.6 million, actually have or can enjoy comfortable retirement because their pension is enough. For large majority of those individuals, what they will receive, for example, right now, 4 or 5 million of our indigent senior citizens will only receive 500 pesos per month through the social pension program, even up to its increase through the initiative of Congressman Ordanes, that will amount to only 1,000 pesos per month. And we, as daily consumers, know how 1,000 pesos cannot even get you through 2 or 3 days in today's market, right? What's more, because of the ceilings that we have put in place in our society, such as, for example, an existing retirement age, 50% of senior citizens who are left at home suffer from some kind of depression because they feel that their life has no purpose anymore. And to further exacerbate this, the pandemic has put a spotlight on our senior citizens because when we expose them to their vulnerabilities to the pandemic, we saw that how lacking our health infrastructure is to actually accommodate them. Echoing Chairman Quijano, we only had 4 residential care facilities in the whole country. And while we have specialized hospitals for heart, the lungs, and our children, we have one geriatric hospital in the Philippines, and it's not even a specialized hospital that caters specifically to the needs of our senior citizens in Manila. And our SSS pension, for example, pension increase, has been suspended for a very long time. What does this mean? That means that for our senior citizens, they still are in great need of support infrastructure from our government and projects and programs to that effect. Because what they have right now, because the lack of the support infrastructure actually takes them off a conducive environment where they can actually enjoy the retirement and be active senior citizens and have healthy aging. And when we were observing, for example, Western countries, we've already observed how the focus of their legislative focus for senior citizens has always been trending towards healthy and active aging for senior citizens. In the Philippines, ours is mostly survival because our efforts are still not enough. That's why through the initiative of Congressman Ordanes, we have filed for multiple bills that we hope can change this trend. For example, we have recently filed a bill for senior citizen employment that will focus on upskilling senior citizens for the digital world. So before, when we go to Singapore or other countries, we say, buti pa yung seniors nila, di ba? They're able to work, they're able to provide for themselves. For us, as according to the data of Dr. Grace and Dr. Sunny, most of our senior citizens have to rely on their families for financial support, not because they want to, but because the situation and the circumstances of our country force them into that situation. We we filed a bill creating ushering for the creation of a national and regional geriatric hospitals for senior citizens. Through this, we hope that our senior citizens, the 200 geriatric doctors right now that we have in our country, can further expand in population. Because the reason why we have a limited number of geriatric doctors is because they do not have hospitals where they can actually practice and or learn, diba, to become one. And then now, we also want to abolish compulsory retirement age. And I think this was one of the more controversial bills that we filed. The reason for this is that when we filed for the for to abolish the compulsory retirement age, it is based, or the retirement age is actually based on a misconception that if we have a retirement age, then suddenly we will have more opportunities, job opportunities, or employment opportunities for young workers. But research actually debunks this because according to Harvard and the UN, when we actually abolish the retirement age, we actually expand economic opportunities for all age groups because of more economic opportunities for everyone. We also, or Congressman Ordanes also wants to expand political opportunities for senior citizens by giving them a voice through the sanggunian of senior citizens. These opportunities or these areas and structures will give them will help our senior citizens become economically, politically, and politically active while ensuring that they have the necessary health support from our government to perform their duties. So, yun lang po. To Dr. Grace and Dr. Sunny, thank you very much for the research. We hope that you will you will engage in more research regarding these topics. We have more bills planned, and if we hope that we can coordinate with you in the future as we create more policies for senior citizens. Kasi I know that these topics that we have outlined, for example, how to make them politically active, socially active, economically active, are just the tip of the iceberg when it comes to the problems that our senior citizens, our more than 12 million senior citizens, are suffering from. And we are on a timeline because by 2032, the Philippines will soon become an aging population. So our country must change its infrastructure to adapt to to having more senior citizens, or else we will be rendered, our systems will be rendered inutile by this. So yun po, maraming salamat po for the time. Our office is thankful to the CPBRD for the opportunity to present, and to Dr. Grace and Dr. Sunny for their research.
Maraming salamat, Attorney Charles. Now we give the floor to our final panelist, the representative of Congressman Abante. May I give the floor to Ms. Jacqueline Joan Sario for the feedback.
Good afternoon, everyone. I have been given the privilege to read Congressman Benny Abante's reaction, and it is entitled "No Lolos and Lolas Left Behind." So the LSAP presented to us by Dr. Grace Cruz and the study that deals with late life depression in the Philippines, shared to us by Mr. Sunny Afable, are valuable tools that should be maximized by Congress as we work to improve the quality of life of our country's senior citizens. On the basis of available data, it appears that our senior, quote-unquote, population is growing, that it now accounts for about 8.5% of our country's population, which is translated to more than 9 million people. Of this, about 57% struggle with daily living and mobility issues. And it is forecasted that by the year 2030, 11% of our country's population will be 60 years old and above. The data gathered and the results of these studies confirm what senior citizens advocates have long feared, that due to their age, Filipinos aged 60 and above are far less healthy and far less economically secure than the younger working age Philippine citizens. The indicators reinforce the case for better care, increased benefits, and special programs to address the concerns of our senior citizens. The research also shows that older Filipinos are not just more prone to sickness and health issues because of their advanced ages. It is clear that they too are more vulnerable to mental health issues such as late life depression, although Mr. Sunny clarified earlier that depression is not necessarily due to age, but driven by other factors. With this data at hand, the primary needs and well-being of our seniors must now be addressed before caring for them becomes even more costly. And it is not too much for the government to address now with priority the plight, needs, condition, and well-being of our seniors. even just in recognition of the services they have contributed throughout their lives for our nation's development and their productivity in the community, even at their age. Legislative measures on the matter may just be a little gesture of gratitude for what they have done and what they can still do for our country and in the community they live in. But certainly it can bring a smile to their faces. As the psalmist said in Psalm 71, verse 9, "Cast me not off in the time of old age, forsake me not when my strength faileth." As I see the situation of our seniors, I feel that the greatest concerns of most of them that need to be addressed with urgency are financial assistance, mobility, medical and health care, and recreational and health activities, which may ultimately address the issues of stress and depression among them. Our seniors should be properly and adequately taken care of by the government because with their knowledge and experience, they are rich sources of ideas for the enrichment of programs contribute in sustaining national to the end of improved measures focused on the economic and medical care needs and on the physical and mental health of our seniors should now be considered under the spirit of urgency. The need to provide our senior citizens with specialized care due to their inherent vulnerabilities is a rationale behind my refiling a measure that would establish the National Center for Geriatric Health and Research Institute, a healthcare facility that is specially suited for the particular needs of our senior citizens. In the same measure, I am seeking the creation of regional geriatric specialty centers in the DOH retained hospitals. This bill was already passed on third reading towards the end of the 18th Congress, but unfortunately, due to time constraints, could no longer be deliberated in the Senate. Given all the information unearthed by the LSAP, it is clear that we can no longer put off the establishment of a facility like the NCGHRI. As the study points out, ours is a population that is almost aging, and the percentage of senior citizens continues to outpace those of other age groups. Improved healthcare and a growing emphasis on proper diets and wellness should extend Filipino life expectancies. So more and more of our citizens will require treatments that address ailments that are associated with the elderly. A facility like the NCGHRI would also serve to address the need to acquire accurate and timely data about the senior citizen sector. It could spearhead research initiatives intended to improve senior citizen healthcare and provide a venue for studies that will help us better understand the physiological and psychological needs of our lolos and lolas. To highlight the contribution of our elderlies and in recognition of the services they have provided throughout their lives for our nation's development, and being the living memory of our history, it is just appropriate to extend some specific benefits and privileges to all senior citizens, whether indigent or not. In line with this, I have filed a measure for all Filipino senior citizens to be entitled to a monthly stipend as shown in the slide. As you can see, the proposed monthly stipend will increase by 500 pesos every 5 years. And by the time the senior citizen reaches the age of 100, the proposed monthly stipend will be 5,000 pesos. And that is the cap, no further increase after that. This measure also includes the granting of letters of felicitation and cash gifts to honor all Filipino senior citizens with permanent residence in the Philippines. Again, as shown in the slide, a letter of felicitation from the President of the Philippines congratulating the senior citizen for longevity and a cash gift in the amount of 1 million pesos to centenarians to be given on their 100th birthday. 90,000 pesos cash gift for nonagenarians to be given on their 90th birthday, 80,000 pesos to octogenarians to be given on their 80th birthday, and 70,000 pesos cash gift to septuagenarians to be given on their 70th birthday. I will also be looking at expanding and increasing the benefits for senior citizens under existing laws, particularly on the following: increase to at least 30% the discount on the purchase of medicines, the professional fees of attending physicians and licensed professional health providers providing home healthcare services, the medical and dental services, diagnostic and laboratory fees, actual fare for land, air, and sea transportation, and the funeral and burial services for the death of senior citizens, and the grant of a minimum of 20% discount relative to the monthly utilization of water and electricity. In the twilight of their lives, our senior citizens should be able to rely not just on their families, but also on the state. Having served as productive members of society, they have earned the right to rest, retire, and live the rest of their days free from sickness and stress. The LSAP recommends that we pass more laws to promote the physical and mental health of the elderly, and as a card-carrying senior citizen and a legislator that has consistently worked to uplift the welfare of older Filipinos, this representation pledges and plans to do just that. Thank you.
Thank you, Ma'am Joanne, for those very detailed provisions. Before we continue with the next part of our program, may we request everyone to turn on their video so we can have a group photo. Video on po tayo lahat para po sa group photo. Whenever mag-count po ako ng 5, pag-count ko po ng 5, ready na po lahat for your smiles. And I will wait for the advice of the tech team. Pag sinabi po nilang, okay na. Okay, game. 1, 2, 3, 4, 5. Think happy thoughts. Smile. Tapos no. Okay na? Di pa? Di pa po. Keep smiling. Di pa? Or chat? Sensya na po. Almost 150 tayo. Mahirap mag-artista.
Fourth page. And we're good to go.
Good.
Thank you. Maraming salamat.
Now, may we request everyone except our panelists and speakers to turn off their video and be muted. Can we have, naka-on po lahat ba ng video ng ating mga panelists? We need to have the videos of Dr. Cruz, Mr. Afable, Attorney Quijano, Attorney De Belen, and Chief of Staff John Sario para po sa ating open forum. So together, can we see them? No, we should have more. Sige pa, kulang pa.
Wait. Spotlight.
Looking at the time po, actually it's 3 o'clock. So I think you're still all here. Can we request 10-15 minutes of your time? Pasensya na po for the extension. Importante po yung open forum natin. We're good. Oh, better na tayo. Okay. So I'll go through the questions. Ito na yung order, ma'am. So the first question is from Dr. Maricar Bautista.
Dissemination
awareness.
information.
Would you like to add some, Mr. Pablo?
Yeah, I agree with Grace. Why not both, diba? As our studies have shown, both material support and direct financial support can help older person's psychological well-being. At the same time, nagagamit rin nila itong assistance na to support their family.
Okay, let's go with Attorney Quijano.
You know, we cannot rely on government alone for the benefits. In fact, that's the reason why focus must be given on the family and society. A lot of businesses and a lot of NGOs are more conscious now of helping the seniors, especially with a bigger number. And so, to me, talagang kailangan ng yung attention, yung service. But on the other hand, yeah, yung financial naman is talagang kulang. Yung binanggit ni Attorney Charles na 500 talaga, kulang talaga. But then again, we have to accept the fact that our country is really on this level of difficulty financially. And so we can't help but focus as well on anong pa bang makakaya ni senior citizen para makapagtrabaho at makapag-produce. Yan yung nakikita natin na pwedeng gawin. Thank you.
Ma'am Joanne po, any feedback? Pa-unmute po, ma'am.
I agree that both din po, I believe that's Kong Abante's stance, kaya din po he is really looking at ano pa yung measures na pwedeng maipasa para makatulong sa ating mga senior citizens.
Okay, Attorney De Belen.
Our position has always been both, because we do know that it works hand in hand. Your services, these are blanket programs and projects. Hindi nila na-accommodate yung mga unique situation ng mga senior citizens. Kunwari, hindi naman lahat ng senior citizens kailangan ng specific medicine or specific toiletry or food assistance, di ba? That's where cash assistance comes in, because the cash assistance accommodates that unique need of senior citizens, their individual need. That's why it has to be both. Thank you po.
Okay po. Let's move to the next question from a Zoom participant. Sabi, both studies show the lack of awareness of government programs such as on health insurance, immunization, and these can contribute to poor health among the elderly. What means would best increase awareness of these services? Awareness raising. Paano pinaka-effective way to raise awareness among the elderly on these services? Who would like to answer po? Can I have two of you answer? You can unmute po kung sino pa gusto na. Yes po, Attorney Quijano.
Actually, the creation of the commission in itself is a good start, although it may still not be enough. We are barely beginning. We have not even populated our regular employees as yet. We're waiting for the input coming from DSWD, so would we be able to make a jump start? Still, I think a systematic approach of this government, yung whole of government. For instance, when I was asking that the database be supported by local governments, I asked LGU about, DILG about it, and in bansa.
Pwede no, pag may database, tas may number text blast. Sino ba pong pwedeng may feedback? Sino ba pong pwedeng may sagot? Anybody? Just one more. So that, yes, Attorney De Belen.
Okay. I think the opposition of Congressman Ordanes on this has always been, and we echo the sentiments of Chairman Quijano, has always been, number one, get the senior citizens involved in the process. That's why he initiated the creation, for example, of the National Commission of Senior Citizens and the Sangguniang of Senior Citizens. Because when they're involved in government, that's when they actually are the ones who seek out the information about their rights and privileges. And second, accessibility. Recently and soon, Congressman Ordanes will launch his own hotline for complaints and concerns of senior citizens through the 1212 hotline. So by making your government accessible to the people, that's when they know that if their concerns are being taken action on by the government, then there's more incentive for them to know their rights kasi they can enforce.
Yes po, very briefly, Sir Afable.
Marami din sa mga senior citizens natin actually affiliate themselves with the Office of the Senior Citizen Affairs. So perhaps magandang ma-expand pa yung mga OSCA natin, palawigin yung kanilang presence in our communities and expand their function and provide some sense of organization to our older persons. And magandang avenue yun for disseminating programs and services for older persons.
Maganda yung ideas, no? May hotline, mayroong database, tapos mayroong yung involvement. We move to the next question from Mr. Joseph Solis. Sabi niya, with the increased, I think it's connected to sa binanggit ni Attorney Quijano earlier, with the increased life expectancy of our population with fast-growing senior citizen population, should we also raise the mandatory retirement age for public and private sectors to 67 or 70 years old? And it was, nasagundahan siya ni Mr. Roderick Castillo na sabi niya, in other countries, senior citizens are able to work at fast food chains or grocery are allowed to. Can the government support these kind of privileges? Can we have Ma'am Joanne? What is the stand po of Rep. Abante?
I believe it is good idea po, lalo na marami pa naman yung mga senior citizen na able pa naman. And it is good for their self-esteem na alam mo yung hindi ka na lang umaasa habang kaya mo pa namang magtrabaho. Makakatulong din po sa mental health.
Meron po ba on a particular age na nabanggit na or wala pa?
Wala pa naman.
Wala pa naman. What about po kay Attorney Charles? Meron po bang age na napag-usapan?
Actually, our position to that, we abolished the mandatory retirement age. And there's a reason for that.
Abolish totally.
Because we think that the determination, yes. And we have to make retirement optional. Because we think that it has to be up to the senior citizen to decide when he can retire or when he's not capable of working anymore. So we have what we call bona fide qualifications. So that will be the new substitute for occupational qualifications. So upon reach a certain age, you have to go to your doctor. So for example, 8 years old ka na, kaya mo pa pala kaya pa to work in a call center or to teach. Why should we stop you from actually working? So as long as you're capable, as long as you work, then you can work if you choose to. So that's why we are in favor of abolishing it. And I think dito, si Chairman Quijano is a testament of that. Yeah. Na kaya pa ng senior.
So lipat po tayo. Chair Quijano, you raised your hand po.
Yeah, I raised my hand because I'd like to acknowledge the efforts of Congressman Ompong Ordanes, who was the first one who said, i-lift natin ang retirement age. But I realized na hindi lang lifting ng retirement age. As I try to scan the laws, nako, hindi yung madali magtrabaho dahil may SSS law. You'll be compelled to retire at 65. May GSIS law. You'll be forced to retire at 65. May civil service law. And so I realized that Congress may have to debate on ano ba talaga, baka pwedeng may multiple retirement. I know of a handful of Filipinos here in the Philippines na nakapag-retire twice, as in the case of Justice Remedios Salazar Fernando, who retired sa Supreme Court, then is retiring again sa Court of Appeals. Can you imagine if the Filipinos would have 2 or 3 or 4 retirements, as the case may be? We have heard a lot. Sa US, may kaibigan akong nag-retire at 40 because military man siya. Nagliwaliw, nagtrabaho uli. At age 60, magre-retire na naman siya. 2 retirement, kaya this has to be debated by Congress kasi may mga nag-aaral sa ano ba, makapag-generate ba tayo, ano yung mga premiums, yung mga actuarials, etc. So I'd like to give this to UP Population Institute to lead in the debates.
Bibigay po natin kay Dr. Cruz. Is there any finding related to LSAP on the elders' willingness to work past retirement?
Actually, retirement is a Western concept. Because in the Philippines, which is agricultural for most of the older persons anyway, although the profile is changing over time because we are now having more and more educated older persons who are in the formal sector. So it's really their health that is determining their retirement. But it's nice to discuss, what is that, perfect time. And the trend is we have to look at life expectancy because in the international literature, they go together. As you live longer lives, you can extend, but it's optional if you want to retire. But because in many European countries, they want to retire early, even if you say optional mandatory retirement is late. They want to retire early and they enjoy life. So it's really, those many considerations out there about retirement age. So you have to study them more closely.
We no longer have time. We can just accommodate one more question. Ang question po from Ms. Rosemary Salwali ay, what are your insights about the senior citizen discount benefiting mostly those who are able to afford to buy medicines and go to restaurants anyway? Are there alternative policies that can be pursued which can benefit all senior citizens, especially the disadvantaged ones?
Yeah, can I
So,
say something about that?
yes, go ahead, ma'am.
Yeah, because our study findings consistently show that, when they conceptualized this law, the spirit was really to target the poorest of the poor. But when you look at the way it is implemented, the ones who are taking advantage are the rich and the implementation. But of course, there are complications when you try to segmentize the older persons in terms of the implementation of these policies. But that's the finding so far, and we're not reaching our intended targets as far as these discounts are concerned.
Meron po bang feedback from the representatives po ng ating mga Kongs? There is a need to revisit daw the implementation, even the provisions of the law?
Actually, for me, no. Sige.
Okay.
I deferred muna to Chairman Kiano. So,
Yeah, go ahead, Charles. Go
Chairman.
ahead, Charles. Sige.
Okay. Bale for hours and earlier, diba, that's why I stated that there is a perception, and this is an outdated perception. Citizens are financially capable, they are well off, they're okay, and they're comfortably retired in our country. Because when this law was made, it was what, 2003, right? And then subsequent amendments after that. During that time, we do not suffer. Our inflation is not this high. Our economic infrastructure is not this bad, diba? And that's why I think that the law is not the problem. I think what we have to do is to economically and socially empower our senior citizens so that they can benefit from the law, right? That's why most of the bills that Congressman Ordanes has proposed has always been to find ways to promote healthy and active aging through employment, expansion of pension, make them politically active, provide the health safety nets, for example, free dialysis, vaccines, health checkups for them, so that when they reach a point where they are already economically, socially, and medically empowered or healthy at that, then they can enjoy the full benefits of the law that is for them in the first place. So, yun lang po yung position namin with regards to.
Yeah, may I?
Yes, Attorney Kiano.
May I copy paste yung answer ni Charles? But then again, I'd like to react to Dr. Grace. Actually, I am so much in favor, Dr. Grace, doon sa differentiation. Kasi even the social pension thing, you would realize that may mas nangangailangan, at hindi gaanong nangangailangan. And so the UP Population Institute offered some advices dito na nagsabi na, what should be given most is yung pinakamahirap. Looking at it differently, yung 20% discount, siyempre may mga nagsasabi sa akin na pambihira naman yan. Ang income ay milyon-milyon pero naghihingi pa rin ng 20% discount. Pero binigay mo na may batas eh. So I think we have to really find ways to improve on our laws, but on the other hand, improve on our database more importantly. Kasi nahirapan ako, Dr. Grace, if I advocate, for instance, na i-address yung issues ng poorest of the poor, number one, magkakadebate dahil sino ba ang mas poor? Yung poor sa Metro Manila or yung poor sa Visayas or sa Mindanao? Yung issue of poverty threshold will have to be resolved as well. So marami pong dapat gagawin, and I hope that we can, without debating and hating each other, we can actually build a better construct of serving the senior citizens. Thank you very much.
Let's go over the two questions that have been answered through the chat. There was a question from Pam Manalo, which states that how accepting is the Philippine population to the idea of care homes and facilities for the aged. And sabi po nila Dr. Craze, LSAP findings indicate that 81% of older Filipinos think it's a good idea to have homes for the aged, but only 17% desire to live in a residential institution if near the current residence. Oo, pero 17%. And then the other question from Sir Jerome Cubelo was, I realized that Dr. Cruz did not include the vices that every senior citizen may still have, like smoking and drinking out. Dapat ay naban na ng government ang industriya ng mga may bisyo po. Older people about their smoking and drinking behaviors, only 17% of respondents are current smokers, while 32% are former smokers. 29% report they're currently drinking, 29% are former drinkers. So that's about it po, what we can accommodate for the open forum. Maraming salamat po for our panelists who gave us not only their time, but also their expertise. And thank you po for everyone here for joining us today. As a token of our appreciation po, may we present certificate of appreciation. Flash lang po natin very, very quickly. The certificate of appreciation reads, okay, this is awarded to Dr. Grace Cruz, Mr. Sunny Boy Afable, Chair Franklin Quijano, Honorable Rodolfo Ordanes, Attorney Charles de Belen, Honorable Bienvenido Abante Jr., and Ms. Jacqueline Joansario, in gratitude for sharing their invaluable insights and expertise during the virtual knowledge sharing activity held on 8 November 2022 entitled Policy Priorities for Dignified Aging in the Philippines, signed by Dr. Romulo Meral Jr., Deputy Secretary General of CPBRD. Before we formally close, meron po bang gusto mong bigay ng just 1-minute message from any of our panelists, from our speakers to panelists, Dr. Cruz, Mr. Afable, Atty. Quijano, Atty. De Belen, Ma'am Joanne? Last minute po message for all of us. We are 150 strong people here. Yes po, Atty. Quijano, 1 minute po.
Well, I am in the midst of the challenge, being the National Commission of Senior Citizens Chairperson. And I thank everyone. I hope I'll be able to trigger the interest of all so that an integrative sectoral office, which is under the office of the President, will be more mandated and empowered. Thank you very much.
Maraming salamat po. Anybody else po from our speakers and panelists?
For our office, thank you everyone. I'm seeing that there's a lot of people from the private sector, NGOs, and the public sector who are here right now to join us in this event. And I hope from our office that we get the opportunity to collaborate with everyone here as we develop more policies for more projects for senior citizens, because we do know the importance of your participation as we create more holistic and responsive policies for them. Thank you very much.
Yes po, Dr. Grace Cruz.
Yeah, this is a very good venue where we can, share the results of our surveys, our researches, so that they can be used by policymakers and program managers. So we encourage more of these activities in the future. Thank you.
Ma'am Joanne, any words po?
So I agree with what all the others before me have said. Napakaganda nga po talaga ng webinar na ito, at sana this is not the first and the last, and sa susunod it would be best if Congressman Abante will be present. Mas marami po siyang pwedeng ma-share, at lahat tayo ay aligned na gusto natin na ma-uplift talaga ang quality of life ng ating mga senior citizens, especially ng higit na mas nangangailangan. Thank you so much po.
Thank you po. We'll hold you on to that commitment. What about Mr. Afable? Any final words po, sir?
I think yung discussion this afternoon raised very interesting insights. Actually, mas marami pang points for future discussion. Like we have a debate on universal versus targeted social pension benefits, extending the retirement age, at marami pang iba, no? But I think our goal should be to let older persons maximize their remaining years.
Maraming salamat po sa ating lahat for being here. Ating lahat, ano? Thank you, the University of the Philippines Population Institute po for this partnership. We hope that this become part of a series of knowledge sharing engagements with you. Thank you po sa CPBRD team members for all the effort. And of course, to all our attendees, Maraming salamat po for attending. Hindi po tayo nabawasan hanggang sa dulo. Don't forget po to fill out the feedback form. We will be showing the QR code and sharing with you the links. Without the feedback form, if you didn't answer the feedback form, you won't get any certificate of attendance. So please don't forget to fill that out. You can access the presentations and webinar highlights in our CPBRD website. Just check the events section and we'll post that highlights and the presentations available by next week po. Maraming salamat po. This officially ends the webinar of the policy priorities for dignified aging in the Philippines. Enjoy the rest of your Tuesday. Salamat po. Sagot na po tayo. Maraming salamat po sa panelists and speakers. Salamat po.
Bye.
Salamat po.